Dear audience, welcome to my 9-month progress report. Let me introduce my PhD topic, which is control of fear memories and the management of dental anxiety. I'm Ábel, a 5th-year dental student and the first-year DMD PhD student. My vision is less anxious patients in the dental office, and my mission is to provide data for policymakers to create guidelines. I have several projects in this year, and I would like to present my first one, which is about dental fear and anxiety and its pharmacological management methods. Please look at these pictures. How do you feel about them? For most of us, these are everyday work instruments, but for some of our patients, these can be the subject of their fear. This diagram clearly shows that the reason of fear from dentists mainly arises from pain and injection. If this fear becomes so severe, we can call it a condition, which is dental fear and anxiety. It means unrealistic negative emotions associated with dental treatment. It affects around 150 million people in Europe and US together. If a patient has dental fear and anxiety, it means they will visit us less often or not at all, only when they have serious pain. So these can lead to untreated dental conditions which can affect their overall health. So we should prevent it and treat it. What can we do? We have psychological interventions, behavioral therapies, and also pharmacological interventions. Let's focus on these. We have benzodiazepines, which are potent drugs, but they also have notable side effects and addiction potential. We also have herbal extracts, which can be effective as well, namely valeriana and passiflora. So our aim in this study to find the most effective yet safest management methods for dental fear and anxiety. And this is our clinical question. We would like to investigate patients undergoing dental treatment. Our interventions are different pharmacological interventions, different administration routes or combinations. We would like to compare these to placebo, and our outcomes are anxiety scores or different physiological state anxiety parameters like blood pressure or heart rate. And we would also like to investigate the safety profile and side effects listed on the slide. Our hypothesis is that benzodiazepines and herbal preparations both can effectively reduce dental fear and anxiety, and the latter have better safety profile. So the clinical implication of this project is that if we can effectively reduce dental fear and anxiety, it would mean that the patient can have the treatment that they need. They can come to the office and have a treatment. They will also have better cooperation and satisfaction at the end. Also, it is really important that better cooperation means that they will have less complication after our treatment. So we designed the two-domain search key. The first domain targets dental fear and anxiety, and the other one is about pharmacological interventions. We identified around 13,000 records, and after the title abstract selection, it's still about 700. So now we are still in the full text selection phase with around 80% done, and the deadline is the end of this month. So now I cannot show you figures yet, but I can introduce my other project, which is a Eurostat analysis. It's about also the anxiety and dental treatment. So what is anxiety? Anxiety is a nervous disorder characterized by a state of excessive uneasiness. It is the most common mental illness in the US, affecting 40 million adults. Also, around a third of the adults experience any anxiety disorder at some point of their lives. So why is it important for a dentist? Studies show that if a patient has general anxiety, it is really likely that they also have dental anxiety. And as I showed earlier, dental anxiety is really a big problem for us because it can lead to untreated dental condition. So our aim in this study to understand the correlation between chronic anxiety and the use of dental care. Also, we would like to investigate whether patients taking medication for anxiety, so the medication could facilitate the use of dental care. We would like to use Eurostat microdata, individual patient data. We would like to investigate people with chronic anxiety. We have subgroups with medication or without medication for anxiety. We would like to compare it to healthy individuals, and our outcomes are dental visits and expenses for dental care. Our hypothesis here is that people with chronic anxiety will visit the dentist less frequently, but those taking medication for anxiety visit more frequently compared to non-medicated patients. So the clinical implication here is that properly managed chronic anxiety is really necessary for patients to come to the dental office and have the proper care that they need. I would like to introduce my second project, which is about congenital heart defect patients and their oral health. So what are congenital heart defects? It's when a baby is born with an abnormally structured heart. It can mean different structural aberrations. It is the most common type of birth defect worldwide, affecting 40,000 births per year only in the US. It means in every 15 minutes, a baby is born with this condition. We also know from histological studies that this patient has altered and weakened tooth structure, meaning that these teeth are more prone to caries. We have to know that this histological finding is really present in clinical practice. This is our aim in this topic, to evaluate whether these patients have better or worse oral health than the others. If it's true and they combine with poor dental hygiene, this can lead to severe infections, not only affecting their mouths, but their systemic health, affecting other vital organs such as the heart. And the heart of these patients are not so resistant. Their heart is more susceptible for severe infections like infective endocarditis, which is a life-threatening condition and really difficult and expensive to treat. So we would like to prevent it. It's really important as dentists that we can do different preventive strategies to prevent infective endocarditis and maintain good oral health for these patients. So our aim here is to investigate whether the oral health status of people living with CHD is different from healthy individuals. We would like to investigate patients with congenital heart defects compared to healthy individuals, and our outcomes are different caries indexes and caries prevalence. We would also like to investigate periodontal status and other oral health parameters. Our hypothesis here is that patients with congenital heart defects have worse oral health parameters. The clinical implication of this project is that when we diagnose a congenital heart defect patient, it is really important to refer them to dentists. And as dentists, we should provide this patient tight dental control and utilize all preventive strategies available for them to prevent serious risks. So I would like to summarize my projects. The first one is about dental fear and anxiety and its pharmacological management methods. My Eurostat project is related, investigating general anxiety and dental care use, and my second project is about congenital heart defect patients and their dental management. So I would like to end my presentations with the words of Ábel Szentgyörgyi. A discovery is said to be an accident meeting a prepared mind. So thank you for your attention.
Thank you very much for your presentations. And I would like...
Thank you for your presentation. It's extremely interesting and I think very important. I have a question about the first project. What ages are you looking at? Is it the difference between kids and adults in anxiety of dental work?
Thank you. So generally, we are looking children and adults as well, but the agents they are using for children is slightly different. So we would like to compare the different methods, like a network meta-analysis, but as we are not finished with the full text selection, it's really hard to know whether we can do a network meta-analysis. Thank you.
Thank you very much for your presentation. It was really interesting. I also have a question regarding the first project. So as I understand, the goal of the project is to increase the visits of patients in the dental office, which is initially prevented by fear and anxiety. So if, for example, there is a well-tolerated safety and efficacy of the benzos, for example, then would you prescribe the benzos at the office, at the dental office, or would it be like a chronic administration? So a patient which is anxious to go to the dental office would be anxious until he gets the benzos. So when he would get the benzos? That's the question.
Thank you. So it's a really important question, and I know that the study is only investigating acute administration of these drugs mostly. There are some studies with some behavioral therapies combined with benzodiazepines, which could be the most effective, I think, because they are not treating only their state when they are at the dental office, but they are treating their general expressions, I mean the negative emotions associated with dental treatment. So, but we don't have so much study on that yet.
Thank you very much.
Thank you.
I also have a question. You have completed the full text selection in the first project, if I'm right?
Not yet. It's
not
around
yet.
80%.
80%.
Yes.
But you have an idea about the literature. Does the literature differentiate between different specializations like oral surgery, pediatric dentistry, prosthodontics? Is there a chance to do a subset analysis based on that?
We also record the dental treatment that they done. So basically there are two big categories, which are oral surgery and pediatric dentistry. So, and they really use different administration routes and different drugs as well. So we would like to compare. For oral surgery, mostly third molar surgery is the most common procedure. And for pediatric dentistry, it's just general dental care.
Thank you. Thank you very much.
Thank you.
Good morning. Thank you, and congratulations on your wonderful presentation. I would like to ask you, could you please tell us a bit about the selection criteria on the first project? Do you have any specific inclusion criteria or exclusion criteria? Thank you.
Thank you. So, due to the high number of studies, at the end we decided to only include RCTs. So that's the main inclusion, and the other one is to measure the anxiety somehow like standardized anxiety scales. And a lot of the studies aren't using the standardized anxiety scales. They just measure some physiological parameters, so we have to also include the physiological parameters. But for age and sex, we don't have any restrictions. So basically, the studies only include patients with good health, non-medicated patients mostly. So that's our criteria as well.
Thank you.
Thank you very much for your presentation. I will ask a question a little bit connected to the previous one. So, what do you think, what can cause heterogeneity later on? Is there a possibility that, for example, population can cause heterogeneity in this case? For example, the reaction to the medication, or is there a difference between different population in this case? What do you think?
Thank you. So, well, generally, when we talk about mental health, it's really hard to measure. So, the main outcomes are not so hard. I mean, they use the scales, which is an exact number, but every individual is different. So, when we ask the patient, rate from 1 to 5, how did you feel about the treatment, they can have really different reactions. So basically, I think in studies, the heterogeneity can be high as well, but between different studies, it can cause a problem, but we would like to address it somehow when we come to the point.